The MC3 program is sponsored through the University of Michigan to help provide education and consultation services for psychiatrists to meet the mental health, the developmental and behavioral health of our pediatric population.
MC3, or Michigan Clinical Consultation and Care Program, provides no-cost psychiatry support to primary care providers in Michigan who are managing patients with behavioral health needs. So this includes pediatric patients up to age 26, as well as perinatal patients of any age, so pregnant, postpartum up to a year, or contemplating pregnancy.
MC3 has been a great support not only to me but also to my families by giving me resources to help manage the mental health needs of my kiddos. It just provides a seamless approach to care where we don't have to wait a long time for care.
There are a limited number of psychiatrists in Michigan, and specifically a limited number of child and adolescent psychiatrists. So families are often, very often, coming to their pediatrician for help with these behavioral health needs, for getting prescribed psychotropic medications. So the main purpose of MC3 is to really give those providers all of the information they need to be able to treat those patients successfully, and so that those patients end up getting the services and the treatment that they need, even though there is a lack of child and adolescent psychiatrists in Michigan.
Reaching out for consultation with a psychiatrist is very easy. MC3 provides you with a consultation form that's very easy. I like to complete it because it gets all my assessment tools that I use, the GAD-7, the PHQ-9, and you can have all the results of that, along with the presenting problem and a brief history. To begin the process, you'll first speak with a licensed medical social worker and give them the information. They then will contact a psychiatrist through the University of Michigan Pediatric Psychiatry Program. And the psychiatrist will actually give you a call within a few hours. And she has all of the information available to her, and then you kind of fill in the blanks of the rest of the information that she needs. After the consultation, you will also receive a summary of the consultation, which I scan into the patient's medical record, and a copy can be given to the parent so that they can see the decisions that were made, which is very helpful, not only to me that we have a record, but also to the parent.
MC3 also provides a lot of great educational opportunities, so they have a lot of great recorded modules on the MC3 website regarding a variety of topics for behavioral health in primary care. And we also offer a lot of live training opportunities, conferences and things like that, all free to the providers.
My favorite part of the MC3 program is not only their educational resources, but also having that psychiatrist in my fingertips. It's almost like having a psychiatrist right here in my office that I can bounce ideas off of. And also, every couple of years, MC3 comes out with this wonderful psychiatric and psychopharmacology reference sheet. It's a little folder that has all of the medications in it, and this is something I keep on my desk. Both myself and my attending physician use this almost on a daily basis, and it's a wonderful resource to have, not to mention it's free.
As part of my role as a behavioral health consultant for MC3, I'm embedded at a local pediatric practice called Best Kids, and there I am able to work directly with kids and families that are referred to me by the providers there to just kind of be an on-site support, providing information, psychoeducation, brief interventions for the families there. And then I'm also able to link the families to needed resources and support in the community. Sometimes that means referrals back to community mental health or other mental health providers in the community, just to kind of continue to build up the knowledge base and build up the resources that are available in our community to primary care providers and pediatricians, and therefore to kids and families.
The families are so appreciative because having Elizabeth right there in our office, the kids are comfortable in our office, they can come in and see Elizabeth right and schedule an appointment right in the office. And she is such a great resource. Families really appreciate her, that she has the ability to refer children for counseling, for play therapy, and that she just knows all the resources. Not only that, Elizabeth is able to give our parents a lot of reassurance and to let them know they are doing a great job with their kiddos.
So in last fiscal year, in the Thumb region, there was 55 provider to psychiatrist consults. So that would be, providers reaching out to speak with MC3 psychiatrists regarding patient care.
Consulting with a pediatric psychiatrist has always been a very pleasant experience for me. It's easy, it is not time-consuming, and it provides the best outcome for my patients and their families. I would encourage anyone to reach out to MC3 to utilize this service.
For more information about the MC3 program, you can go to MC3's website, which is mc3michigan.org. There's also an option on that website for prescribers if they want to sign up for MC3 so that they can be eligible to consult with MC3 psychiatrists same day. There's other sign-up options available as well. If you are working in the behavioral health field but aren't a prescriber, you can sign up for MC3's email list so that you have access to all of MC3's educational opportunities as well. You can also feel free to contact me, Elizabeth Lozen, by email for more information as well.